Hi. The result of the provisional first counseling result is already out. So congratulations to everyone who's taking MD in pediatrics. In my opinion, it's one of the most wonderful branches that are out there. Especially it's when you actually move out of pediatric residency, even as someone who's doing DM, I would say it's still an end branch. It's one of the few medical branches which are still an end branch. You really don't need to do a DM. But having said that, uh, if you want to, those options are also available. It's a very versatile branch. You can get into adult DM as well. You can do pediatric DMs as well. You can get into AIMS, PGI institutes for your SR-ship, which in turn increases your skill set. So this is a general video about what to expect as far as pediatric residency is concerned. What is the future from what obviously I know, what has been my interaction with my colleagues and in general, and certain do's and don'ts about pediatric residency. The first thing that I'm going to start is about the books, because this is pretty much the one question that you must be asking each and everyone amongst you. So there are only two books which are necessary as far as the pediatrics is concerned. One is Nelson, and the next is a PG textbook of pediatrics. So consider Nelson like Robbins. It's very heavy book, but it's a better book. And consider PG textbook of pediatrics like Harsh Mohan. It's slightly written in an Indian manner, slightly easier manner. Doesn't make it any less of a book. In fact, it's much more Indianized. And for certain topics, especially for hematology, oncology, I actually preferred PG textbook of pediatrics over Nelson. So, but all in all, these two books are actually sufficient for your entire pediatric residency. But if you have certain interest in particular subspecialty, or you want to explore more of that subspecialty, there are certain subject specific books which I would going to recommend. There are two subject specific books that I'm going to recommend everyone should have, because they are written so wonderfully. The first is the NICU protocols of AIMS and Cloharty, especially because the one thing that differentiates a pediatrician from any adult person. See, it's fully possible that a child with seizure, an adult neurologist is seeing sometimes. It's fully possible that even an acute lymphoblastic leukemia, ALL or AML in children, sometimes even adult oncologists, because the principles of therapy are similar, they also end up seeing. But neonatology is something which nobody touches. Neonatology is our domain. Neonatology is something which only a pediatrician knows how to manage. And as far as neonatology is concerned, NICU protocols of AIMS and Cloharty, these two things together can ensure that you can actually manage your own SNCU or even a level 1 NICU for that matter of fact. The second thing is, the one thing that adults never end up touching is pediatric intensive care. They can from their experience with adolescent, they sometimes want to adult specialties want to barge into the 7-10 years age group also, but they never ever venture into the intensive part of pediatrics. And that's why PICU protocols of AIM and NICU protocols of AIMS, these are two must have books. And in fact, I'll say in first year of your residency, you really won't get too much time to study, but if you really end up having some time, whenever you end up having, let's say, one Sunday is off in 1 month, or you have 3-4 hours, you don't know what to do, maybe reading a PICU protocol, one protocol of upper GI bleed, let's say, or a NICU reading about apnea or sepsis. These are the things that are going to make first year residency academically much more better for you. Having said that, in first year you really won't have too much time. Other subject specialty books: pediatric nephrology, Professor Arvind Bagga, he's our HOD here right now in AIMS. Amazing author, amazing teacher, has been so passionate. He's the editor of Ghai also. Along with Dr. Aditya Sinha, has written a really good book on pediatric nephrology. If you don't want to buy the main book, there is a Protocols in Pediatric Nephrology also, this book, Protocols in Pediatric Nephrology. Then there is a main green colored book also. If you don't want to buy the main green colored book, this book is actually sufficient for an MD pediatrics level. To a large extent. Cardiology, there's a book is called Park's Cardiology, but I really won't recommend that book. I believe what is given in Nelson and PG textbook of pediatrics is actually enough. For neuro, books like Fenichil are there, but IAP series on pediatric neurology is there. But again, I would say Nelson is more than enough. The only two subspecialty books like I talked about that you should know are NICU and PICU protocols. For hematong, there's a book called as Lanzowski, but again, I'll say Nelson and PG textbook of pediatrics is enough. For everything, pretty much Nelson is actually enough. Even for your SS entrance point of view or your SR-ship entrance point of view, if you want to join AIMS as an SR, these two books are actually enough. In first year, you really won't get too much time to study. It's only in second and third year which will get time to study. And so I'll say that in first and second year, like I told about, NICU and PICU protocols should be done in the first year itself, and rest can be actually done in the second and third year. How should you approach residency? So think of it as a job market. Frankly, after doing your pediatric residency, you are going to be employed by either corporate hospitals or you are going to have your own private setup. both things have two different kind of skill sets. And I would say that residency, you can always read later. Okay, you can acquire knowledge later. I can still read books, I can still read Nelson, even if I'm a pediatric oncologist. But the skill sets that are acquired during residency stay with you. So during your residency, don't focus. And your entire energy should be focused on acquiring a skill set that makes you a skilled pediatrician. And like I told you, the one thing that nobody touches as far as children is concerned is the intensive care part. And you should be extremely skilled in that, and it will actually make you much more confident as a pediatrician as well. So what are the skill sets that you should definitely acquire? And especially when you are going into a corporate setup also, you will be required to man the emergency, you will be required to man the ICU, the NICU. And the skill set that you are definitely required to have: intubation, central line, umbilical artery and umbilical venous catheterization, PICC line insertion. PICC line is a plus and minus. And last but definitely not the least, cannula. The first and the foremost thing that a pediatrician is known for is the fact that they can put a cannula in any goddamn person. And I remember that once I was posted in my BMT posting, and in the same ward there was a 80-year-old person, and the nurses could not find a cannula. They called me and I was able to put a cannula. So pediatricians are known for their cannulation skills, and cannula is a really important skill that you should master in your first year. And in your second and third year, you should focus on the emergency skills, that is your intubation, your central line. You should be thorough with your PALS and BLS guidelines as well, UAC insertion and PICC line insertion. These four skill sets if you have, you will be very, very confident. Intubation, central line, PICC. If you have the skill set, you will be very, very confident wherever you're going to practice. See, Foley's insertion, NG tube insertion, and stuff like that, you have either learned it during your internship itself, in adults at least, and these skills are not really too tough, to be very honest. But intubation, central line definitely requires some amount of training, and your goal during your pediatric residency should be on acquisition of these skills. Now coming, if you are someone who wants to pursue SS. Now what is the scope of SS? The most in-demand branches are PICU and NICU. These are the two most in-demand branches, slightly followed by HEMONC. Now the thing is that PICU and NICU is free from any encroachment, like I told you. Adults do not encroach in neonatology. Adults do not encroach in intensive care. HEMONC has some amount of encroachment, but PICU, NICU and HEMONC are clubbed together because these are intensive branches. You'll always be on your toes. That's what I liked about HEMONC in general, along with the fact that HEMONC used to be very cerebral in nature, in my opinion. Then if you want to live a chill life, a lot of people want to do that, then pediatric endocrinology and neurology are in-demand branches also, and they'll let you have a decently chill life as well. Now, what are the sort of not too much in-demand branches? They are your nephrology and genetics. Okay, their demand is also low, but they do end up having a relatively chill life as well, not during the residency, but in general as well. But if you are interested in research, these two branches are really, really good. Now, as far as the SS prep part is concerned, I'll say that you can start from your third year. Third year is the best part to begin your SS preparation. I cleared it in my first go, but having said that, I would say that you really don't need to clear it in first go. Most people during their SR shape, they keep on studying simultaneously. And along with that, I have a news for you that I have joined, I would be taking some classes. Divya has properly joined doc tutorials, and I would also be taking the HEMONC classes on doc tutorials for SS preparation. It has always been my goal to teach in whichever capacity I have. I've always taught, be it 1 PYQ per day series or, recall videos or so on and so forth. And I'll be teaching for pediatric residency, hematology, oncology, and certain other portion, which I'm very confident about. And if you are someone who likes my style of speaking, if you're someone who likes how I teach, doc tutorials would be releasing this pediatric SS course, but it won't just be a pediatric SS course. Consider it as something which is going to help you during your residency. If you're someone who's doing DNB, you feel that your exam pass rates are low, you need a companion as far as your a video companion as far as your preparation for your DNB and exit exam is concerned. Consider them as an adjunct, and I can be reasonably sure that we have created this video with all the passion, and we have taught thoroughly and conceptually, so that be it your SS prep or exit exam prep, DNB exit exam prep is done thoroughly. It's both me and Divya together, and we have created this course, and it will be launched in some time. It's not launched right now, but it will be launched in some time. Just a news from my side. Now, another thing that I wanted to emphasize, that SS prep, there is no rush. So most of them do it during the first and second year of their senior residency actually. And the reason there is no rush is that, like I told you in the very beginning, pediatrics still is a very much an end branch. If you have that PICU and NICU skill sets during residency itself, you really don't need to survive, if earn money as far as corporate setup is concerned. And also, if you're wanting to settle in a tier 2 and tier 3 town, general pediatrics itself is a very lucrative OPD branch with a very chill life. Vaccination, growth and development, pneumonia, LRTI, diarrhea will make up a huge chunk. And even a conservative estimate, you have done your residency, you take 500 rupees per OPD, and you have a very minimal OPD of only 15 patients per day also, you'll easily rake up around 2 lakh rupees per month. As far as the corporate setup is concerned, this is the tier 1 I'm talking about. These are the actual offers that I also got just after completing my residency. So if you have 2-3 years of experience, that is, you have done your senior residency, post SRship, the salaries are in the range of 2 to 2.5 lakhs up to 3 lakhs in tier 1 cities per month. And if you just after your MD you are working in a corporate setup, you will easily get 1.5 up to 2 lakh rupees per month. So decent salary. I'm not saying not extraordinarily high, no, definitely not extraordinarily high, but good salaries. And the good part is you really don't the good part is that general pediatrics itself is a very, very lucrative branch, especially if you're willing to settle in tier 2 and tier 3 towns. These salaries jump by a 50,000 to 1 lakh rupees per month approximately, I'll say. So 1.5 will become 2.5 on starting salary as far as pediatric oncology is concerned when you do your SS, and it increases your employability in government institution. New aims are coming up and they all need super specialists. So if you are someone who's looking for a stable government job, professor wali life chahiye, so SS then also becomes a requirement, because departments are being created. Us point of view se SS बहुत important हो जाता है. And then I'll again reiterate, me and Divya. Hi Divya. So we both have created this course. It's an ongoing process. It will be released soon, very soon. And if you're going to join a pediatric residency, your residency is going to start in next 1 month. If you feel that कि रात को आके बस एक वीडियो देखनी है and कुछ पढ़ लिया जाए, so you can use it like that. तुम्हें लगता है कि नहीं फर्स्ट ईयर में क्यों हम लोग वीडियोस लेक्चर्स क्यों दे रहे हैं? इनफैक्ट इवन आई विल सजेस्ट कि फर्स्ट ईयर में इतना करने का कोई पॉइंट नहीं है. बट हाँ, सेकंड या थर्ड ईयर में होगे, SS के लिए प्रिपेयर करोगे या DNB एग्जैक्ट एग्जाम के लिए प्रिपेयर करोगे, आई एम प्रीटी श्योर दिस कोर्स इज गोइंग टू बी एड अ मच वैल्यू टू यू. एनीथिंग यू वांट टू ऐड अबाउट for pediatric residency?
Also, we have made a group of where we'll be discussing all the questions and all the clinical scenarios that we encounter here and there in the residency, and it will be a fun experience sharing all the cases and discussing.
So we have created a Telegram group basically. I'll give the link in the description, and we'll start sharing and let's have an interactive discussion. Welcome to the world of pediatrics.
Also, I have my own YouTube channel where I'll be sharing my experience with the residency, as I am freshly out of the residency. All the things that I did were right, all my downfalls, all the mistakes that I committed, so that you don't do that in your journey. So do subscribe to my channel also.
हाँ, इसका भी कर लेना. So that's it. That's about the do's. That's about the general aspects of pediatric residency. I'll be taking such more through 2-3 more videos. Divya will also be posting on her channel on how you can approach a pediatric residency. There's one thing that I'll definitely tell you: the first year is going to be very, very hectic. Be prepared for that. When you are able to get through the first year, the second and third year, you actually start to enjoy pediatrics in its the wonderful branch it actually is. And congratulations to everyone who has gotten MD in pediatrics this time. Thank you and have a nice day.